Hello, everyone. My name is Susan Hepburn, and I'm a professor in the Department of Human Development and Family Studies at Colorado State University. And I'm also trained as a licensed clinical psychologist, and I've been working in the area of educational identification of autism for approximately 20 years. So I'm really pleased to be here today to present the second part of our webinar on the early identification of autism spectrum disorder. I'd also like to thank Brooke Carson, Rhonda Daniels, and the Educational Identification Autism team at the Colorado Department of Education for access to some of the materials from their educational identification trainings. I'm also grateful to my mentors, Wendy Stone and Sally Rogers, who gave me a lot of learning opportunities and taught me a great deal about early identification and intervention. Many of their ideas are reflected in this presentation. And I'm also grateful to all the children and families that I've had the opportunity to work with over the years, as they've taught me a lot about what autism looks like in young children, as well as the experience of growing up with a young child who has some features of an autism spectrum disorder. And I also really appreciate, as a psychologist, the ongoing collaborations I've had with many speech language therapists and occupational therapists, as well as special educators who've taught me a lot about this field. It is my hope that by the end of this presentation, people who are participating will be able to describe 5 key elements of an evaluation for autism spectrum disorder in young children, to be able to think about at least 3 evidence-based tools and describe some strengths and relative weaknesses of those, to recognize a few things about how family culture and language can impact the evaluation process, and I would add to have a few resources on hand to be able to explore those topics. And finally, to think about things that will help when you're differentiating between an autism spectrum disorder, a lack of social experience, and possibly trauma in a young child. So as I mentioned, this is part 2 of a 2-part webinar, and previously in part 1, we covered some of the things to look for in an autism evaluation when looking at young children. So early emerging social behaviors, communication behaviors, the range and flexibility of interests and play skills, how a child uses his or her body, and their overall responses to the environment. Now today, we're going to look at what you'd actually do in your evaluation when trying to decide if a young child is presenting with an autism spectrum disorder. So I've organized this talk into 5 parts, which I think of as critical elements for any evaluation for a young child. And those elements are described here. We're going to talk about the importance of interviewing the parent to learn about the child's developmental history, as well as the family's current concerns. The importance of integrating reports from multiple people who know the child well, could be parents, family members, child care providers, preschool teachers, early interventionists. And we're going to talk about well-validated ASD checklists or screening tools that can be given to those individuals. Third, it's really important to observe the child in a variety, if possible, of unstructured social interactions. So kind of a free play situation where there aren't any formal interventions or structures. This will allow us to really see what the child naturally does in various social contexts. Fourth, we need to have direct observation of the child in daily routines, things such as mealtime, dressing, toothbrushing, or reading together, things that parents and children do on a daily basis. And then lastly, it's very helpful to have some direct interaction, I should say, between the assessor, who's a professional in child development, through playful activities that will allow you to see some somewhat subtle communication and social behaviors that you may not get a chance to experience directly when you're just observing. And today we'll talk about some of the formal measures that help you do that, as well as giving you ideas about how you could construct your own interaction. So let's begin with the parent interview, which should really focus on the child's developmental history, what might have been going on medically, any significant events in the past, as well as beginning to identify the parent's current concerns. Now, there are several public domain tools that you can access to guide a developmental assessment interview. Some people prefer to send a written form and ask the parent to fill it out. I find it can be a really good way to structure the initial conversation, either through telephone, video conference, or a home visit. There are also several autism assessment tools that will give you either ideas for creating your own developmental history section or provide you with important questions. I'm going to walk you through some of the highlighted elements I'd like to see on a developmental history when I'm considering if autism is relevant for a young child. And I'm referring by a tool that is available through the autism team at Colorado Department of Education. Within this developmental history form, you see some examples of what can be important information to know about early emerging development. So one of the first sections I look for is understanding the milestones, what happened in the area of motor skills, what happened in language development for this child at a young age. We also know that if a child has had an uneven history of language development, for example, used words spontaneously for a time and then stopped using those words and kind of plateaued or held steady in their language development without adding new skills, understanding that aspect of an early developmental trajectory can be very informative because it's quite unusual for a child to go through even a brief loss of language skills unless that child has a condition such as an autism spectrum disorder. So getting information about the child's developmental milestones is a really important start. I also think it's helpful if you have a sense of the child's health history, understanding if a variety of conditions have been a part of that child's experience. And this is just an excerpt here of a much longer list. It's also important to get a sense of any current medical conditions, medications, or treatments that the child may be needing. And in this particular developmental questionnaire, the team also brought in a couple of items from a general developmental screener that gives us a sense of the child's current social and play behaviors, just trying to kind of build up a mental image of how the child interacts and behaves. It's good if this developmental interview also includes the child's preferences, games and activities he or she really seeks out, and a more strength-based approach can be quite helpful in building rapport. And it's a good opportunity to open up the conversation regarding significant concerns about behavior or any traumatic events that may or may not have happened to the child in the past. It's also important to get a sense of any existing evaluations, and it's a good chance to ask the family if you could see those records as you're trying to develop a deeper understanding of the child. It's also good to understand if there are current interventions underway. For example, if the child is already enrolled in speech-language therapy, to know when that started and how intensive those services can be. So once you have this sort of general structure, you may find that if you're doing an interview, the parent can give you a lot of examples and go into more detail and really help you to understand what a typical day is like for the family, what parts of the day might be problematic. In any case, opening up with this parent input piece is a really important part of the early identification process. Then we move on to the second element, which is where you want to gather reports, specific reports about specific kinds of behaviors from multiple people who know the child well. It's really important to choose an evidence-based screening tool for autism spectrum disorders, which has been normed or validated and had scoring developed for children who may be between the ages of 18 months and beyond, but basically you need to make sure it's developmentally sensitive for use in young children. So definitely look for the ages that the tool has been validated for. There are some tools that have versions for both parents and interventionists. Others do not, and it's important to choose the right tool for the right person who's giving the information. It's also helpful if the tool you choose provides a scoring method that can assess risk. So, as we're gathering this information from parents, teachers, childcare providers, we are looking at it as informing a bigger picture. It's kind of like building a mosaic, and this is giving us a sense of how the child is perceived in different settings. At this stage, you would never let the results of one tool tell you if it looks like autism or not. You're gathering multiple reports in order to paint a picture. So we are using these tools to think about assessing risk for autism, helping us understand what behaviors of concern are presented across settings. Now, there are many different tools that you could choose from, and some of you may work for agencies or school districts that have a set of tools that they prefer to use. That's great. We're going to highlight a couple of tools and try to talk about some of the characteristics to look for when you're seeking out an appropriate tool. Also like to refer you to the resource section of this presentation. For every tool we'll talk about, we will let you know who the publisher is or how you could get your hands on it. Some of the tools that I'll describe to you are free, but most would require an initial expense to buy the test kit. And as we'll discuss, most of them have a training criteria for the person who is administering the tool and interpreting it. So I will try to identify those things as we move through these tools. So the first is the Childhood Autism Rating Scale, the second edition. This is a set of behavior checklists that can be used by multiple raters to give their impressions of the child in multiple situations. It does begin at approximately age 2, so it could be used in the second year of life within the Child Find system, for birth to 3, but most likely it will be used in a preschool situation. There are 2 versions of the tool, one for when the child has a significant delay in language development, which they refer to as the standard version, and the other where the child is described as meeting language milestones on time and solving problems well within the average range. The CARS is useful, as I mentioned, for bringing together multiple viewpoints. It allows you to observe in natural settings as well as interview, and it comes up with a score that's assigned to a severity rating. It can also be used as you begin intervention and you want to see if a child's symptoms of autism may be changing over time. The Autism Spectrum Rating Scales is also a tool that is commonly used in 2 to 5-year-old children with autism spectrum disorders. It has subscales that reflect the aspects of autism that impact a preschool or a school environment. Some of the items are sensitive for the home environment, but one of the advantages has been for use in educational contexts. One of the disadvantages is not being as heavily influenced by parent perceptions in less structured settings. But it does have a parent-caregiver version, which is well validated. Both the autism rating scales and the CARS would need to be implemented by either a school psychologist, a speech-language pathologist, an occupational therapist, or someone who has been trained in how to interpret behavior checklists with standardized norms. Similarly, the Social Responsiveness Scale, second edition, is a really good set of tools where you have teacher and caregiver or parent versions, but the age to start this would be a little bit later, from approximately 2.5 years throughout the lifespan. So the SRS-2 is often a choice of tools when you're working with elementary school age children with autism spectrum disorder, or even those in the secondary school years. It can be helpful because it has different norms for the biological sex of the child, and the developers are working towards more diverse norms to be able to compare their tools to. So the advantages of this tool seem to come through when children are a bit older. But continued validation efforts of the preschool version are demonstrating that it does have potential, particularly after the age of 3 and before the age of 6. You may have also heard of a tool called the MChat, which is commonly used, we hope, in pediatric practices. In fact, it's recommended by the American Academy of Pediatrics for the MChat to be implemented at 18 months and 24 months, those well child visits. It's also being used more and more by child find teams and individuals working throughout the early intervention system. There's a new version which has been demonstrated to have some improved specificity. In other words, its ability to tell the difference between children at risk for autism versus having any developmental problem. So this new version is called the MCHAT Revised with Follow-Up, and it's available for free, I believe, through a public domain website, which we've attached in the resource section. It includes 20 items. The caregiver can complete it independently, or it can be done by an early interventionist, with some interviewing. While it was developed for use in pediatric visits, it's also been studied internationally, and it's available in multiple languages. So when you go to the website, take a look at the various translations. If you're working with families from other parts of the world, this may be your best tool. It's very strong in identifying any developmental condition in young children as compared to a child who doesn't have any developmental concerns. And as I mentioned, this new version is getting better at being more ASD specific. And this is primarily because it provides a scoring algorithm that has 3 different risk ranges. And then what you're supposed to do as the assessor differs based on the risk level of the child. So if the child is identified as being low risk, in other words, the parent endorsed 3 or fewer items, there's no follow-up needed, and you can basically rule out autism according to this screener for this child. If the parent endorses between 3 and 7 items, you're now in the medium risk territory. And this requires a brief follow-up interview where the developmental specialist contacts the parent and goes through each of the items that were endorsed, asking for information. If at the end of that brief interview, about 10 minutes actually, 2 or more items continue to be endorsed, then the child is referred for a full autism evaluation. In the high-risk group, if a child receives endorsements on 8 items or more, then the flow was to refer that child for full evaluation. In other words, quite likely that autism is there, and we need to understand better how this child is presenting. So the MCHAT could be considered a level 1 screener, meaning that it helps you pick out the kids who may be at risk for a developmental problem, possibly of the autism variety, as compared to those who are developing typically. With a level 1 screener, you often need to do an additional tool to make sure that you're understanding if autism is actually the driver of the developmental problems that you're observing. So another tool that kind of straddles this line between a level 1 screener, finding autism within the general population, and a level 2 screener, getting more specific about autism from a developmental language delay, for example. Another example of a tool like that is the infant-toddler checklist, which is part of the Communication and Symbolic Behavior Scales program, which was developed at Florida State by Amy Weatherby and Barry Prezant over the past 25 years or so. Recent reviews of screening tools in autism spectrum disorder suggest that the CSBS, and specifically the infant-toddler checklist, is a really promising tool for 9 to 20-month-old infants and toddlers. It's not recommended for use below the age of 9 months, and you would need to use a different version of the tool if you're looking at a child who is older than 24 months. So on a positive note, the CSBS gives you a combination of parent report and observation tools that are really developmentally sensitive. Some of the data on the infant-toddler checklist suggests that it has strong sensitivity. In other words, if autism spectrum disorder is out there, it's likely to find it. And it's actually doing pretty well in specificity in a recent study of the revision. But like other screening tools, scores that go above the risk cutoff on the infant-toddler checklist mean that the child has a developmental disability of some kind. Further inquiry is often needed to determine if it is because of autism or another developmental condition. Now, if you're using multiple screening tools and gathering information from multiple people, it's going to be important to have a way to track what it is that you're learning. So this is an example of a tool that I've used on school consult services where we just keep a running list of the tools and pull out the possible behaviors that are reported that could be consistent with ASD, as well as a list of behaviors that do not signal ASD, but are probably associated with something else. And then a quick way to just keep your own records, noting whether or not the child obtained a score above the risk cutoff. I believe that what I'm about to say is true for all developmental evaluations, but definitely when you're evaluating a young child, it is never about the scores in my experience. It's not about the numbers. It's about the qualitative information that you're gaining, the things that parents are reporting, the things you're observing, and the exact sort of behavioral examples you have to work with. So in addition to collecting multiple informant reports about the child's behavior in different contexts, it's also really helpful to observe the child in unstructured social interactions. And I realize this is going to differ depending on where it is that you practice. If you have the opportunity to watch the child in unstructured free play with a sibling or a cousin or a neighbor child, that can be very informative. It can happen outside or inside, with or without objects. You just want the parents or the adults to do as little facilitation as possible so that you can observe the child's natural social engagements. It's also important to make sure that you're at least observing for 15 to 20 minutes because you need to see how much time it will take before initiations and responses can occur. This will allow you to, even at the very beginning, be able to differentiate from temperament and ASD. Sometimes you can just do these observations in an unstructured way, keeping a running list of what it is you see, or you could use a tool to guide those observations. And I've listed some of the measures that would give you some ideas for what to look for as you're watching a social interaction. Let's take a look, for example, at the functions and forms checklists from the Colorado Department of Education trainings. This is something that our speech language colleagues would be very familiar with. It's basically a list of reasons why a child communicates. Those are referred to as communicative functions, things like requesting an object, requesting help, requesting attention. And then it also gives you a list of communicative forms. What does the child do to meet this communicative function? And that could be a variety of things, such as using sounds, words, eye gaze, gesture, or even a tantrum-like behavior. And then to see if you get integration of more than one or just one. So as you're observing a child, you may be looking for specific social and play behaviors, and you're probably also looking for, is the child sending and receiving messages in a way that fits the context? In other words, what is their social communication like? And a functions and forms checklist can really help you gather this information in a clear way. Just as you want to watch the child's behavior in an unstructured situation, it is important to watch the child within daily routines to see how the child interacts with a parent when they're doing things that give them a variety of sensory inputs, when there are a variety of challenges or new skills to try or to integrate. You can also get a sense of communication and social interaction within these daily routines. And then the fifth and final element that I want to mention today on your methods for early identification is to make sure that you spend some time in direct interaction with the child. As somebody who has a lot of training in typical development, and many of you have a lot of expertise and training in atypical development, it probably requires you being in those interactions with the child to get a feel for that child's strengths and relative weaknesses when it comes to interaction. It's something that we can watch, but when you're in there playing with the child, you can really feel what that transaction is like. And you may find that this is something you want to do multiple times for short periods of time, particularly for a young child who doesn't have a lot of social experience or who may be a bit shy temperamentally. So during these direct interaction moments, it's a good idea to take notes during these times, or with parent permission, have a videotape recording so that you can also document some of the more subtle things that may emerge. You want to choose play activities that are going to help you elicit the things I have listed here. You want to make sure you have a handle on the child's overall ability to orient to others and to see what they do to initiate interactions, as well as to respond when somebody else starts an interaction. You need to have opportunities where you get to witness what the child does to intentionally send and receive a message. So you need to know what they do verbally or with nonverbal behaviors to request a toy they really like or to reject an activity that they don't enjoy. It's important to create opportunities to look at how a child shares their affect or their emotions with you, and that could include everything from enjoying something to being frustrated by something. It's just really important to see a variety of affects and whether or not there's a social piece to sharing that emotion with others. Similarly, we need opportunities to watch if the child tries to direct our attention to things that are of interest to them. Or we also, I shouldn't say or, and we need to see what the child does when we try to get the child to attend to the same thing we're interested in. In addition to these opportunities to observe sharing affect, sharing attention, we also need to see if the child will initiate communication and communicate for just purely social purposes. And in order to do that, you do have to become a familiar enough person in that child's play. In addition, we're always observing for the child's spontaneous and responsive acts with toys. We want to see what their functional play skills are like, particularly given that what a child does with toys can be a really good reflection of the inner sophistication of their language. So functional play as well as imaginative play are both important. And one of the behaviors that tends to differentiate young children with autism from children with other developmental conditions is the ability to play symbolically with a doll. So simple acts such as feeding a baby, putting a baby to bed, or longer play schemes are less common in young children who turn out to have autism. So you'd want to have those play activities available, and you may need to introduce them repeatedly if they're not familiar to the child so that you can observe what they can do with them. You also want to look for spontaneous imitation. Under the age of 3, spontaneously imitating the relevant actions of another person is less common in autism than in other conditions. So look for spontaneous imitation. Look for whether or not the child learns readily by watching and repeating the actions of others, because that tends to not be the best way for young children with autism to learn new things. And in final, we're also always looking at flexibility. Is the child able to pivot and use a toy in an unexpected way? Can they switch activities? What happens if you interrupt a routine? So these direct interactions through playful activities give you a lot of opportunities to observe some pretty important things. Now, obviously, since research has helped us understand what to look for, it's also helped us identify tools that are designed specifically to provide these kinds of opportunities. So you can create your own, or you can check out one of the 2 tools that I'm about to mention to you. And I should let you know that there are additional tools that are in the process of being validated with larger and larger samples that we should learn more about in literature and practice in the upcoming years. But for today, I want to focus on one tool called the STAT, the Screening Tool for Autism in Toddlers and Young Children. This was developed by my mentor at Vanderbilt, so I must admit there is a little bit of bias there. I got to observe the development process and see just how careful the team was as they tried to put this together. And Dr. Stone based all of the items on her previous research on the symptoms of autism in 2-year-olds. So this is an evidence-based 20-minute interactive tool that a developmentalist does with a child with the parent present. And you also have some questions within the tool to ask the parent. The play opportunities are focused on imitation, communication, actions with objects. Toddlers don't feel like they're being assessed during this brief play-based interaction. And you can seek the training that you need through a web-based module that's available through Vanderbilt University. You do need to purchase the kit, which a district or a practice could purchase. I believe it's approximately $500 from Vanderbilt University. It comes with all the scoring forms that you need, and with the training, and once you accomplish the exercises in scoring the tool appropriately, you're now certified and allowed to embed this in your practice. So the STAT was developed specifically for child find teams and has terrific norms for 2-year-olds. So in other words, 24 months up to 34 months. They are also working on extending those norms into the preschool and below. The advantage of the STAT is that the training is relatively less than the other tool that we have in our toolbox as a field, and that's the Autism Diagnostic Observation Schedule. It's been revised, the 2nd edition. So many of you are probably quite familiar with this tool. It is thought of as the best practice tool that we have in autism assessment in the clinical or medical world, and it is sometimes adopted in the educational identification realm. But because of the intensive training requirements and the need to stay practiced, doing approximately 2 to 4 autism evaluations per week is thought to help maintain good reliability and scoring. It's not commonly used in schools. But when it is used, you could use the toddler module for young children. So this is a set of play-based activities that were designed specifically for children between 1 year and 30 months who are not consistently yet using spontaneous phrases. If you were working with a child outside of that age range, or somebody in that age range but who has better language, you would choose a different module, which reflects their language competence. So the ADOS is a very strong tool, but it requires more training and more investment than the STAT when it comes to direct observation. So given that you have 5 elements of an early identification process to consider, everything from multiple reports, direct observation in a couple of different settings, and then direct engagement, all in the context of a developmental interview, it's also critical that we consider what we're now learning are some limitations in the cultural sensitivity of our autism assessment tools. So here, I just want to shine a light on this topic and share some resources and remind you that there are probably some webinars posted in the tri-state that are particularly relevant to cultural competence in evaluation. And I encourage you to seek those out. So a couple of things to think about. We now recognize that understanding the culture of the family is really important in this process. We have to understand what the parents value and expect about child development, what their attitudes are towards a developmental delay or unexpected development. We also need to understand how they feel about an outsider, somebody who might be an expert in development, but isn't obviously an expert in their child, coming into their home and talking with them about the characteristics of their child. That can be very sensitive in some cultures. And it's important to understand the social conventions of a culture. So say, for example, I was working for a while in Alaska, and we would visit some Native people for whom if a young child made direct eye contact with a new adult, that would be considered a sign of disrespect. So therefore, everything that I had learned as an autism specialist about eye contact being an important marker of autism, I needed to disregard, because in this culture, children were intentionally taught not to look directly at adults in certain communicative exchanges. So the more we understand about the culture, the better. And ideally, it is best if examiners share a common culture with the families they serve. So there's a real need in our field to bring in more individuals who represent other cultural backgrounds into this work that we do. Now, many tools that we have that we rely on that have good psychometrics have been developed with items that came out of science that was conducted on primarily Caucasian, primarily middle-class individuals who are predominantly male. So it's just important to know that going in. And we are now finding out that there are different ways that symptoms of autism might be expressed in females versus males, particularly at different ages, and that there could be differences by racial or ethnic group depending on the cultural norms around particular behaviors. So, when using the tools that you've chosen, be sure that you understand the strengths or limitations of its psychometrics and just be ready to put a line in your report that clarifies what those strengths or limitations might be. Transparency is probably the best we can do right now. And as publishers are getting better at seeking more representative normative samples, you may find that you need to check not only the publisher manuals of the tools you use, but look at their websites in a pretty regular way for updated norms tables. So, as a field, we have a way to go to improve our culturally sensitive practices in autism evaluation, but a couple of resources I wanted to share with you that could be helpful in your career development in this area. One is that the Association of University Centers on Disability, in collaboration with ITAC, Technical Assistance Centers, have developed a collection of recommended resources that are specifically helpful for culture. For example, CDC's website, Learn the Signs, Act Early, provides materials in different languages and also gives you links to specific ways that different cultures think about autism. We also find in that same Autism Cares document some resources specific to working with people whose primary language is not English, coming from a team out of the state of Massachusetts. There are also toolkits for Spanish-speaking families available through Autism Speaks. So while this is just the very, very beginning of resources you may find to be useful, it's just essential to always be thinking about the culture of the family as you're embarking on these educational evaluations. And now, as our final topic for tonight, I just want to touch on a couple of considerations if you're trying to differentiate between an autism spectrum disorder, lack of social experience, or possible trauma. This has come up quite a lot in the trainings we're doing in Colorado on educational identification, and we're going to offer a webinar specifically on this topic in about a month from now. So many times in our practice, we run into families and children who face multiple challenges, and these challenges can be complex and deep. Oftentimes our jobs are to identify those challenges and narrate them, and hopefully select interventions that fit well with those challenges. And sometimes when you're beginning to work with a family, you'll start with one conceptualization, such as seeing a child's behaviors under a developmental lens. And then the more experience you have with the child, it becomes apparent that you may need to alter that conceptualization. I want to narrate this dynamic part of this process because if a child has experienced trauma, even if we suspect that they have, but we don't know for sure, ongoing assessment of that child is going to be necessary. Interventions that you select are going to probably be a blend between developmental interventions and trauma-informed care. But I find when cases are really complex like this, it is a question that continues to be addressed across the child's lifetime. Our field is not precise enough to be able to give us the tools to not only identify a set of things in a child to be concerned about, and then to understand exactly where they came from. So sometimes what we're trying to do is put a name to what we see that is interfering with the child's ability to learn and engage socially and communicatively with others. Over time, as we understand the child, we may understand the etiology or the factors that contribute to the onset of this developmental problem. But in many ways, the question of, is it autism or is it a lack of experience? Is it autism or is it trauma? May at some point not be the most important question. The most important question might be, is there trauma? Has there been enough social experience? And do I see symptoms of autism spectrum disorder in this child? So, in my mind, those three things may be co occurring more often than when one is a better explanation of another. And so, particularly as you're starting your information gathering process, you want to keep an eye out for narrating all three of those things if they are present for a child. And then, as the body of evidence comes in and you learn about the child's behavior and functioning in different contexts, you and others can come to a determination to describe what seems to be the primary driver of the child's challenges. And if there is a second thing going on, we'd want to have that narrated too. So I just wanted to lay out that sometimes our desire to put things neatly in a category is not the best way to go when it comes to really complex cases, and that our question may not so much be, the relevant question may not be, is it autism or this? Sometimes is it autism and this? But when we are trying to figure out if autism spectrum disorder is relevant or meaningful for a particular child, we might have a competing hypothesis that, hey, maybe this child is neurologically built just fine. There's no underlying neurodevelopmental disorder here, perhaps. Maybe the child's presenting differently because she lacks social experience. And this becomes particularly important to consider with COVID having just taken 2 years of a child's social experience and really messed with it. So in order to kind of tackle this differentiation, I think the very first thing is to narrate it. If you are starting to see concerns about a child's social and communication behavior, and they have been through COVID as a young child, for example, you'd want to say to the parent up front, we always want to remember your child has not had typical social experiences with other children. So we're going to get to know your child, work with your child, see your child in interactions with you, the parent. But over time, we really do need to see your child have some more experiences with other children, and we can watch how those behaviors grow and develop. So you're always going to gather information about the child's social experiences so you can describe them in your written report. And you do want to plan these ongoing assessments so that as the child gains social experience, you can see what sorts of qualitative changes occur over time. If the child truly has autism, it will take a lot of repetition to be able to learn new skills with new social experience. If the child doesn't have an underlying autism spectrum disorder, one would expect the social gains to occur more quickly with the access to peers increasing. It's really important, in my opinion, and this is not based on the research, based on my opinion of trying to do these assessments, to spend time observing and reporting on the integration of the pragmatics or the communication domain, so that you're really looking hard at whether or not these verbal and nonverbal communication behaviors, such as eye gaze, gestures, facial expressions, are integrated in a smooth and reciprocal fashion. The reason I like to look at those is that they are things that appear to be more neurologically based as a part of the connectivity problems associated with autism. So seeing the integration of complex communication behaviors may help you see kind of the core of an autism spectrum disorder relative to something happening outside the person, a lack of social experience. In young children who do have autism, they tend to share affect really well with their parents. They share attention, they imitate. So a lack of experience with peers shouldn't compromise the quality of a child's social behavior with his or her parents. So I would look carefully at those things. You'd also want to look at the range of play skills used with parents and whether or not the parents can work with the child to shift what they do with objects and be flexible. So for a child who I'm thinking has lacked exposure to peers, I would want to make sure that my evaluation covers those things on the bullet points. There are some behaviors that are thought to be much more specific to autism than even to other developmental disorders. So one of those to look for, which is more consistent with autism, is when a child who's not yet learned how to use language flexibly takes his hand, puts it on the hand of an adult, and then uses that adult's hand as a tool, like to operate a toy or to put something somewhere. When a child manipulates an adult's hand like this without coordinated eye contact, the research tells us that is much more likely to be consistent with autism than another developmental condition. So, when trying to differentiate ASD from a lack of social experience, I would recommend looking at these behaviors that are more neurologically functioning, including the last one, sensitivities to the environment. So, things that don't have to do with peer interaction, but have to do with adapting to the outside world could be most helpful in those evaluations. Now, when you're trying to understand if a child is presenting with true autism spectrum disorder, which is a neurobiological condition, or if the child is behaving in a limited social and emotional way because of experiences with trauma, that's when we are often treading on really tricky territory. And the research on best practice is still developing, and we don't yet have a lot of evidence to rely upon to guide our practices. So what I'm about to share with you comes from consulting the research and hopefully, I guess you would say, informed by clinical practice. Hopefully we will learn more as this field evolves. If you're trying to understand if a child's presenting in a certain way because of autism versus trauma, one of the first things I'd recommend is make sure you get as thorough a developmental history as you can. It's important to understand the timing of things. When did the trauma occur? And it would be helpful to understand if it occurred for a long period of time or was a one-time situation. You also want to understand the timing of concerns about the child's social and communication development. So clearly, if there were concerns about development prior to the trauma, it could be an indicator that the behaviors you're seeing are influenced by an underlying developmental condition. If the child appeared to be developing typically until the age of the trauma, and that age was, let's say, old enough to allow for observation of communication and language development, so I would say after about 18 months, then one could suggest that typical development prior to 18 months is usually followed by typical development after 18 months. So if the trauma happened and then things changed, then you are probably more likely dealing with the behavioral aftermath of a trauma. It's also important to recognize that sometimes this timing is going to be mixed or you won't have enough information. So it's something you want to do and you hope will add to your evidence, but you'll need to see how it all works out with each individual case. In cases I've been involved with, we didn't understand the roots of the trauma until many years later. It may also be helpful to think about how an autism spectrum disorder is thought to be neurologically based. So it's characterized by some consistent and persistent problems in the integration of social communication and sensory adaptations to the environment. So you should see that there is functional impairment across different contexts, that there isn't one situation where the child is just flourishing with rich and reciprocal, well-integrated social, emotional, and communication behaviors. That just doesn't happen in a young child with significant autism symptoms. You may see a child who behaves better with a particular person, or who, when they are with a familiar parent, can be more affectionate and socially available, is really at their best. But those biologically based aspects of autism, self-regulation problems, integrating verbal and nonverbal behaviors, managing repetitive activities and interests, those things are not going to vary across contexts significantly. So if a child functions beautifully with well-integrated, rich and reciprocal social behavior with one person, but then shuts down with another person, that to me is not an autism spectrum presentation. That makes me think there's something going on more in the emotional domain that is perhaps trauma related. Another thing I want to mention that we said in the intro is that co-occurrence of these two things is quite possible, so we don't want to rule anything out. It may be less a question of is it this or that, or have both of these things exerted some influence on the child's development. And if so, let's identify them both and figure out how interventions taken from both worlds can contribute to helping this child. So I would say that the true differentiation between these two things is going to have to do with not only finding really sophisticated markers of what's different on the surface, but understanding the etiology or how these developmental challenges came to be. And that differentiation often requires a comprehensive, multidisciplinary evaluation that would include a combination of medical, clinical, and educational professionals. So depending on where you practice, it may be most important to determine, is autism relevant for this child? Is trauma relevant for this child? And to document both. Now, sometimes a child will present with an autism-like presentation, but there's a different qualitative feel to it. So maybe there is social withdrawal, but you're seeing other aspects of strengths and integration of communication, for example. It can be that when you begin with interventions that are developmentally sensitive and are trauma informed and perhaps are focused on a parent-child interaction or targeting social relatedness or emotional understanding, if the child doesn't have neurologically based autism, but rather has an autism-like presentation, literature suggests that progress on these core social relatedness features tends to be faster for a child that has a trauma history as opposed to neurologically based autism. And so in this way, you can see how sometimes you begin the interventions while continually assessing. And it may not be until you can see the response to the intervention that you or the family feels clearer about how best to describe the origin of the child's social difficulties. So even with a trauma history, if the child is showing qualitative differences in reciprocity, nonverbal communication, and flexibility, identifying autism is appropriate. You actually don't have to understand how problems arose, what their history is. As much as you need to know, is the child presenting with a set of behaviors or features that meet the educational criteria for an autism spectrum disorder, if you're working in the school system? It could be that you think trauma may be driving this, but the child is meeting criteria for autism. It could be that the behaviors that are associated with autism are the things that are getting in the way of accessing an appropriate education. So particularly in the school system, your job is often to identify what the developmental concerns are and then reflect those in the educational eligibility categories that you choose. And it is most important to document both if both seem to be present. You just don't want to not include the information because it will give you ideas about how to program depending on whether or not autism or trauma is in the child's background. So we will cover this topic more in a future webinar. For now, I just wanted to introduce that topic and help you get thinking about our role in early identification is identifying people who are at risk for autism. We don't have to expect that we're going to go down the road of a lifelong diagnosis or even tease apart the etiology of these difficulties. Our role has more to do with a functional identification that will allow intervention to begin and will inform the interventions that we select. And so today I wanted to try to share some of the tools that we have that are useful in identifying young children at risk for autism. Also hope that you'll take away the message that it's really important to address this evaluation in a comprehensive way, and we outlined 5 elements of that evaluation process today: developmental history, reports from multiple people using well-validated measures, observing the child in structured and unstructured contexts, and directly interacting with the child to look at reciprocity, pragmatics, and flexibility. Now, before I leave you, I want to let you know about a couple of resources that we have posted in this particular slideshow, links that will help you to assess autism as well as communicate with parents when you're sharing results. So we also have included information about how to seek training in some of the screeners that we recommended today. And we always recommend checking out the professional development opportunities that are available through the archived webinars from the Tri-State Autism Network, of which this webinar is a part. And then finally, as I mentioned, we do want to make sure that you could locate the measures we talked about here. And one more qualifying comment, that there are other measures with strong psychometric characteristics that you or your colleagues may opt to use. We only had time today to focus on some of them. So these are some of our favorites based on their psychometrics, but there are other tools out there and being developed all the time. And then lastly, I just want to leave you with the reference list. We can make these things available to you if you prefer to get them in a Word document. So thank you for all of your time and attention. Appreciate that you're working in this important field of early identification, and we'd be happy to stick around and answer any of your questions. So thanks.